Intubation in the critical care and emergency environment is a high-risk procedure. A frequently raised issue is whether or not the use of videolaryngoscopy is better than traditional direct laryngoscopy. We'll review the results of the device trial on this episode of Osler Shortcuts. Over 1.5 million emergency intubations occur outside the operating theater each year in the U.S. alone. Failure to pass the tube on the first attempt is common and has been independently associated with the increased risk of complications. As such, first-pass success rates have been used as a surrogate endpoint for many intubation trials. Videolaryngoscopy is increasing in popularity and availability. Evidence supporting this practice, however, remains of low quality and has seen mixed results. The device trial was a pragmatic, multi-centered, unblinded, randomized controlled trial which recruited 1,420 critically ill patients who required urgent intubation. Patients were excluded if one or the other technique was clearly preferred. Patients were randomized to either video or direct laryngoscopy, and the primary outcome measured was first-pass intubation rate, defined as a single insertion of the blade and successful tube placement. The median age was 55 years, 35% were female, and 70% were intubated in the emergency department. The median BMI was 26, and the most common reasons for intubation were altered conscious state and respiratory failure. 387 unique operators participated, performing a median of 2 intubations in the study each. 91% of operators were either emergency medicine residents or critical care fellows with a median experience of 50 previous intubations. Successful first-pass intubation occurred in 85% of the VL group and 71% of the DL group. No difference was seen in complications. Some interesting insights come from this study. Device was conducted across 11 sites, including 7 emergency departments and 10 intensive care units in the U.S., giving it reasonable generalizability. Interestingly, the benefit seen varied with the level of experience of the operator. The more experienced the operator, the less benefit VL provided. That said, VL still outperformed DL across all experience levels. If you like this summary and would like to know more about the device study, head on over to Osler and check out the full review. Like all Osler content and features, it's completely free. See you next time on Osler Shortcuts.